name is Rahel. I am a second year medicine resident at Inova Fairfax Hospital. I am an alum of the MD MPH program at University of Maryland. So the reason I applied and got an MD MPH is mainly through my background. I grew up in Ethiopia, an East African country that is um, has a lot of infectious diseases, a lot of a lot of health infrastructure issues. So I had firsthand experience of most of the tropical diseases that we learn about in med school. So I was interested in learning about that, going to med school, but I was also around physicians through my family who did a lot of international health work through outreach and community projects. So I had the interest of both a public health and a medicine career. So that's the path I chose. And I chose University of Maryland because of its unique advantages. So as an MD and PH student, I got to work with pharmacy students, law students, social work, um, and other med students in a lot of projects as in the MPH project, in the MPH program itself, but also in leadership positions. So I was exposed to an interdisciplinary approach of looking at uh, problems and being able to work with um, other individuals from different fields. So as a resident, I think that helped me a lot. Right now, I work with pharmacy students. I work with case management and social work on a daily basis. So I think that gave me an advantage into being able to work with through issues with in an interdisciplinary group. And then the other important thing that I was able to do at Maryland was I was able to take, again, because of the unique location with the School of Law, School of Pharmacy, and social work, I was able to take courses at the law school that helped me understand the current healthcare status of the US. So I was able to be exposed to historical events and landmark cases that led or that facilitated to the current, healthcare policy and other important aspects of healthcare that affect me as a physician. So that was one positive aspect that I can remember from my training. Also, as a student interested in global health, I was able to travel to East Africa, so far from Ethiopia, and was able to get involved in an HIV project that led to other opportunities. So I think that's also a very unique experience. The Institute of Human Virology at the University of Maryland has a lot of opportunities. I still keep in touch with infectious disease doctors at that institute. So I think in the future, I see myself getting involved in these projects, getting involved in short-term or long-term outreach projects in East Africa. I still travel a lot to that region. So I think my background and my training in MD and PH, and specifically my exposure to to these kinds of projects as a med student helped me solidify my interest in global health. There's a global health track at University of Maryland that is also designed for students like me. So I think that's also another advantage that I got from being a student in Maryland.